Okay, so if we're looking at CV training for special populations, i.e. we're going to look at children and pregnancy to start with, um, then there are some considerations. So if we look at children, they need to work harder than adults to meet their oxygen requirements. And that's partially because their um, max heart rate is a lot higher. Okay, then we need to look at developing energy systems because children are quite young, their energy systems have not been developed and they're not as efficient. Um, so it's about CV exercising have a positive impact on developing those energy supply systems. And then the recommended type of training, CV training you do, is interval or fartlek because it's far more appropriate because there's those rest periods and there's the changes in intensities. And actually, if you think about the changes in intensities, that has a direct relation to the energy supply systems and developing them. Then we've got pregnancy. So when we've got a pregnant individual, then it's about low to moderate intensity and maintaining blood flow to the fetus. So we don't want to push them too hard. We want to maintain that regular blood flow to the fetus. Okay. We need to be wary of pregnant individuals overheating or becoming breathless. So if they do, we stop them. We ask them to come off. And YMCA say it's much better to do the talk test rather than the heart rate monitoring test because heart rate, as we touched on earlier, can be impacted by pregnancy. So it's much better to do the talk test and see whether they can actually talk and whether they're working at a moderate to low intensity. So can they speak back to us quite comfortably? And that's what we'd expect them to be able to do.